Now, there are reports of several Gauteng hospitals facing water shortages over the past week. Family members visiting patients say they're forced to take bottled water for their loved ones, and health workers are also flagging hygiene concerns. Now, this comes as Johannesburg Water and Rand Water announced that multiple reservoirs are currently under strain. Health Department spokesperson Motalatale Modiba joins us now to give us details and also context as to what exactly is the problem. And thank you so much for your time, Motalatale. Good morning to you. Let's talk about when these, water issues exacerbated, thus affecting, most hospitals and particularly, the health sector. Take us through when you encountered these challenges.
I think it varies, but more or less you could say early last week, and some facilities would have been the week before last. That's when we started obviously having these challenges. And I think the water utilities would have made announcements that they are working on various reservoirs where they've got challenges at various of their pump stations, which of course filters through to our facilities. Facilities that are mainly affected are three facilities, which is Pulosong in Ekurhuleni, and then you've got the Rahima Musa and Helen Joseph, which are in Johannesburg. With Pulosong, this morning when we're talking to them, they have a bit of water that's coming in from the municipal lines, but the pressure is still very low. They have been able to augment that with trucks that have been bringing water in. So currently they've got a stable water supply because their reservoir at 100% as we speak. The plan is to obviously keep them at around 60% so that you don't go below 60% and you keep on replenishing until you've got that stable supply line. With Helen Joseph, they they still have good pressure, because you recall that Helen Joseph, the Joburg Water was able to actually connect them through another line through the Brixton Tower. So they've got good pressure. Their situation has been better since Sunday, so they've not experienced any other challenges up to now. And with Rahima Musa, they still have that challenge that we spoke about yesterday in terms of the update that we gave, where we indicated that they're still having intermittent supply. They are relying on roving water tankers from Joburg Water. They do have boreholes, 2 boreholes, but the yield on the boreholes is obviously not sufficient in terms of being able to ensure that the tankers that they have got sufficient water. So I would say that we are stable, but obviously critical in terms of being able to closely monitor how the situation is improving at the 2 facilities.
So when we think about the likes of Rahima Musa Hospital, for instance, what are the current working conditions of healthcare workers? If we've been hearing reports about healthcare workers, hygiene being compromised, because obviously they have to deal with a lot of washing of hands and washing of, equipment and, whatever they have to use to help patients, and even family members saying that they have to bring bottled water for their loved ones in hospital. According to your understanding, what's the current, condition like while they try to, deal with the current water levels and pressure at the hospitals?
They are doing fairly well. That's why we're able to say that we are currently stable in terms of the 3 facilities. With Rahima Musa, you'd recall that they've got 2 boreholes that can pump about 18,000 liters, and then they've got 2 reservoirs which take about 420,000 liters combined. The Joburg Water is then continuously providing them with roving water. So once the reservoirs, how this thing works, that if the reservoirs are full and they've got sufficient water capacity, it's not a problem to then bring water to the facility, because in any case, with the municipal water or the water that comes from the utilities, it goes to the reservoirs, and from the reservoirs, that's where it gets then pushed back to the facility. So they're doing fairly well. Of course, we do understand that when there's this kind of challenges, naturally what will happen is that when families, especially because these facilities are located within particular communities, it's natural that family members would want to bring some supplies to their community, to their family, to their loved ones, to ensure that they're well taken care of. But so far, the facility is coping, but it's not obviously in a good situation, because you want to have security of supply at all times. And where the they need to then just document. They're able to do emergency procurement just to ensure that within the clinical areas, the supply continues to be sustained. And so far, they have been able to do that. But through the facility management units, we are monitoring the situation just to ensure that we can keep the situation as workable as possible. So we're hopeful that the work that is being done by the water utilities, Rand Water in this instance, and also Joburg Water for the Joburg facilities, will probably bring back the other pump stations that they were working on, which has a big challenge, especially Hest Hill, which is the station that actually supplies both Helen, Joseph, and Rahima. Rahima just happens to be fortunate because they are close to the Brixton Tower, and that's why they were able to then be fed through a separate line from the Brixton Tower.
All right, well, we leave it there, Motalatale Modiba. But thank you so much for giving us this update, and I'm sure we'll get more updates on the go, because Rand Water and Johannesburg Water, I mean, they, continuously give us statements and give us updates on how far, of course, that water, is going in terms of getting enough water to be supplied to both, residents and hospitals and any other, institutions, obviously, that require water. But at this stage, the caution being that the consumption of water currently being, exceeding limits here, and requesting rather residents to use water sparingly so that they can be able, of course, to assist where needed. Health Department spokesperson Motalatale Modiba, thank you so much for speaking to me this morning.